Hello, my name is Martu Pelima. I'm doing my presentation today on controlling hypertension using DASH diet and physical activity. Hypertension is a very sensitive topic for me because I lost my father to hypertension a few years ago, and also I had an aunt that had high blood pressure and she was on medication. She started working out, she got on a diet, she lost weight, she was able to get off the blood pressure medication. So, I'm a living testimony to hypertension, and it runs in the family, so it has a very special place in my heart. Um, Hypertension has been an epidemic in the United States. It increases the patient risk of cardiovascular disease such as CAD, PVD. It also increases the mobility and the mortality of our patients. Um, Lifestyle modification have been effective in controlling hypertension according to American Heart Association. American Heart Association also recommended that patients diagnosed with hypertension or pre-hypertension participate in some kind of healthy lifestyle modification to help control that blood pressure. Let's be very clear, as clinicians, it's very important that we teach our patient that your lifestyle modification like physical activity and a diet will not replace your medication for your hypertension. You need to be compliant with your medication. You need to continue to do your exercises. You need to follow your diet and keep your doctor's appointment. Do not stop taking your blood pressure meds unless the doctor say, hey, your blood pressure is well controlled with diet and physical activity. We're going to discontinue your blood pressure meds. So that's very important as clinician to stretch to our patients. Hypertension is basically defined as systolic blood pressure. Grit. I'm sorry. Hypertension is described as blood pressure greater than 120 over 80. 86 million adults in the United States right now has been diagnosed with high blood pressure. As a provider, if you come in contact with one of these 86 million adults, it's important that you start to educate them early on about lifestyle modification. It plays a major role in controlling high blood pressure. The DASH diet is simple, it's easy. You're not changing your diet or getting on a certain diet. You're just going to modify it where you're going to eat more fruits and vegetables. You're going to slow down your sodium intake. You're going to eat a lot of whole grains. You're going to do fat-free or low-fat dairy products. You're going to do lean proteins such as fish, poultry, beans. And the diet plays a major role in the development of high blood pressure. So it's important that if the patient decides to do DASH diet, they can't do it today and stop 3 days ago. 3 days later, for the diet to be effective, the patient have to adhere to the diet. And physical activity is basically exercise section 60 to 90 minutes 2 to 3 times a week. It's going to help, according to research, it's going to help lower your blood pressure. My PCOT question for this research was patient 21 to 40 years old with new onset of high blood pressure on antihypertensive medication that engage in DASH diet and exercises at least 2 times a week compared to similar group that does not diet nor exercise will have reduction in that blood pressure over 6 months period. So basically I'm saying patients 21 to 40 years old that has been newly diagnosed with high blood pressure or has pre-hypertension that's on medication, I'm going to have these patients engage in a DASH diet and physical activity at least 2 to 3 times a week. And I'm going to try to have a group of patients and divide them into 2 and compare the group of patient that's going to work out and do the diet to the other patients, hypertensive patient that just take medication, and see who's going to have that blood pressure better controlled. The research, prior to doing my research, we searched articles on different websites from the online websites such as the PubMed, Medline, CINAHL. Those were all different websites with great article, evidence-based and peer-reviewed articles that was on hypertension and controlling hypertension with lifestyle modification. Some of the articles was relevant, some of them were irrelevant, but I sought through it and found the best articles that was that was used for this research project. All the article that I picked out of this website have one thing in common, and they all prove that diet and lifestyle modification, such as physical activity or adhering to a diet, will lower your blood pressure if the patient is consistent with it. The key word is being consistent and adhering to the diet and physical activity. My research will be done over a 6-month period. I choose to do the randomized controlled trials. My plan is to use 100 participants, and these 100 participants will be randomly picked from different doctors' offices that has a history of high blood pressure or pre-hypertension. These patients will sign a consent to participate in a research project. I'm going to try to use a descriptive method to assess the patient knowledge about high blood pressure, what they know about the treatment plan and the medication and lifestyle intervention. The population for this study will be adult patients ages 21 to 24, and the study will be done in Charlotte, North Carolina. My goal, as I said earlier, is to have 100 patients, and these patients will be divided into 2 groups. All of these patients will have history of high blood pressure or pre-hypertension that's on medication, but it will be divided into 2 groups. 50 of these patients will be 50 of these patients that are on medication will be asked to participate in the DASH diet and in physical activity 2 to 3 times a week over the 6-month period, and the other 50 will just continue to take their hypertension medication and monitor their blood pressure. And after the 6 months, we'll compare the patient that participated in the lifestyle diet, that participated in a lifestyle modification compared to the patient who just took the high blood pressure medication. The effectiveness of the research will be assessed every 4 weeks, and during the 4 weeks, we'll educate our patient. We will follow up on our activity. We'll follow up on our diet. We'll answer every questions and concern at that time, and just talk to them and encourage them to continue. And we'll also be able to assess if they are making any progress in the research. These participants will be randomized to control group, and they all will have individual brief visit during which they will receive advice and brochure on the lifestyle modification. It's very important that we talk to patient and ask them if they cannot make that appointment, or if they don't adhere to the diet or the physical activity for a few days. They need to contact us right away so that we will be able to get the effectiveness on a lifestyle modification. All participants, regardless of the treatment assignment, will complete a baseline questionnaire concerning our demographic, our education, and our perception of the blood pressure and how to manage it. All BP measurement will be done, will be obtained before we start the research, and then patient will be educated has to effectively take that accurately take that blood pressure, and that blood pressure, they will have to monitor that blood pressure every day before every day in the morning when they wake up, or every day sometimes during the day, and that will be done over a 6-month period. You will also be encouraged to do a face-to-face clinic visitation where question will be answered, and the effectiveness of the lifestyle modification will be checked during that time. Each participant will be educated based on a level of perception and knowledge from the question they answer from the survey. A teaching plan will be implemented and focus on a teaching plan that will be managing hypertension using a DASH diet and a physical activity. So patient will be given complete breakdown of the DASH diet. They will be given a menu of the food that they will have to consume on a daily basis and the food to avoid. And they will be asked to engage in physical activity at least 30 to 60 minutes or 60 to 90 minutes 2 to 3 times a week. The follow-up plan for this research will be all patients will be contacted weekly via email, text, or phone call to check the progress of the research, and all questions will be answered at that time. A face-to-face visitation will be scheduled every 6 to 8 weeks just to, touch bases with the patient and, just encourage and let them know, at the end of this research, they will be very happy with the result. Adherence to the intervention is very, very important. So patient will be encouraged. They will be advised And whatever hindrance they have will be addressed, and the provider at that time be able to find help for them if they have any kind of issues adhering to the diet or doing a physical activity. The daily blood pressure will be that a log will be reviewed at that time, and also we'll have that put it in. We'll have the blood pressure put up in a log, and all of those blood pressure will be reviewed after the 6-month period. Analysis of the blood pressure will be performed to estimate the effect of the intervention on both group after the 6 months period. So those the 50 participants that participated in a DASH diet and a physical activity, and the other participant I just adhered to that took that blood pressure medication, we have that blood pressure checked. We just get an analysis of those different blood pressure and see who had a better control on that blood pressure after the 6-month period. The desired outcome for this research is to prevent and adequately control or have some kind of reduction in the patient blood pressure over the 6-month period after the intervention. Lifestyle modification have the capability to lower blood pressure, prevent high blood pressure, and more importantly, decrease the risk of complication related to high blood pressure. Previous researches has proven that physical activity and dietary interventions can lower blood pressure and reduce heart disease, and also diseases associated to hypertension. And I'm hoping that these patients that participate in this research will have the same result. I'm hoping that the result from the research will motivate and encourage these patients with a diagnosis of hypertension and pre-hypertension while they maintain a daily healthy modification to improve hypertension outcome. The intent of this research is to prevent and manage hypertension and to reduce the mobility and the mortality, and this can be done through lifestyle modification or with pharmacological therapy. But the goal for this research is to make sure these patients have a reduction of that blood pressure through the lifestyle modification and be able to get rid of pharmacological therapy by just adhering to this DASH diet and physical activity. Project dissemination, I have no plan to publish this article, but I definitely will present it to my hospital research committee. The hospital I currently work at are very big on research, and every month they meet like the third Thursday in the month and just review different researches that employees have done. So I will present that to them and see how best we can help our patients that are dealing with hypertension. In conclusion, lifestyle modification such as diet and physical activity has a therapeutic role in controlling blood pressure. Adhering to the appropriate diet could prevent the onset of hypertension, eliminate or either improve the disease process. Key factors that manage hypertension are exercising, DASH diet, and taking prescribed hypertension medications as ordered. Evidence has indicated that regular physical activities such as working out 2 to 3 times a day, aerobic exercises, reduces your resting blood pressure and has other great health benefits. I want to take this time to say thank you so much for listening to me. Hypertension is very dear to my heart because I lost a dear family member to hypertension, and I have a family history of hypertension. Thank you for allowing me to talk to you about hypertension, and this is the end of my presentation. Have a good day.